Good afternoon, and welcome to today's program entitled The Anxiety Factor, the Role It Plays in Addiction and How It Can Be Treated. I'm Charlene Marietti, Editorial Director for Addiction Professional Magazine. Today's program is a Foundations Recovery Network webinar sponsored by Millennium Laboratories. Thank you to our sponsor and to you in our audience for giving us your time and attention. Before we get started, we have a few housekeeping details. Each window on your screen can be moved by clicking and dragging, or enlarged and minimized by clicking the icons in the top right corner of each window. Please use the Q&A area to the right of the slides to submit a question at any time. If you cannot see this area, simply click the red Q&A button. To download a copy of today's slide notes, please click the link in the Resources area in the upper right of your screen. If you have any technical issues during the program, please click the yellow Help button to troubleshoot the issue. A special note about CE credit. To receive credit for today's program, you must click the green CE certificate widget at the conclusion of the program and complete the evaluation form. If you are watching today's program in a group, please download the group submission guide and program evaluation form located in today's resources list and follow the instructions. Please note, CE credit is not available for the archived webinar. It is only available for this live event. At this time, it is my sincere pleasure to introduce our speaker, Christopher Hastings, M.A.L.S.P.E. Christopher Hastings joined the Foundation's Nashville team as Director of Outpatient Services in early 2014. Prior to arriving at Foundations, Hastings served as a psychological examiner at Woodland Hills Youth Development Center, a residential correctional facility that provides treatment programs for teens. There, he was responsible for conducting various assessments. With more than 14 years in treatment, diagnostics, and assessment experience, Hastings strives to provide innovative and unique treatment solutions. A native of Alabama and East Tennessee, Hastings moved to the Nashville area in 1994 for school. He studied clinical psychology at Middle Tennessee State University, where he obtained both his undergraduate and graduate degrees. He holds a professional license as a psychological examiner for the state of Tennessee, where he was one of the youngest senior psychological examiners in the state. Thank you, Christopher, for taking the time to speak with us today. And with that, the audience is yours.
Hello, everyone. Good afternoon to some of you, and good morning to the rest. Today we will be talking about anxiety and the role that it plays in addiction. Now, we will talk about how anxiety is created in the bodies, what current medications are used to treat anxiety, how addiction can form from using those medications and other substances, as well as types of treatments effectively used to treat anxiety. So what is anxiety? Anxiety is closely related to an emotion called fear. Fear is a survival mechanism that exists to help us avoid dangerous situations. Fear keeps us alive in a certain sense because it allows us to look both ways before crossing a street or double-checking car doors being locked at night. It is basically a physiological and emotional reaction to any event that we deem life-threatening. This process serves as an alert to both the mind and the body to prepare us to address whatever we perceive as causing harm, and that can be harm to us or harm to our loved ones. The mind and the body work together in these situations to be an effective instrument in eliminating whatever life-threatening event is in front of us. And this can occur in one of three ways, but we'll speak about those three ways in a minute. This overall response is generally unconscious and cannot be controlled by us. Reactions such as flinching or even gasping for breath, as examples of these reflexes, during the fear/anxiety response. Where anxiety can become controlling is when our cognitions and perceptions come in after the event. But again, we'll talk about that later. I mentioned flinching and gasping as two examples of a fear response. But here on the slide is a whole list of different types of responses that we can have. There is a feeling of imminent danger or doom, the need to escape, heart palpitations, or even just a racing heartbeat, sweating, trembling, a shortness of breath, a feeling of being choked, or even feeling smothered, some chest pain or discomfort, a tightening of the chest, some nausea or any other type of abdominal discomfort, dizziness or lightheadedness. Some people experience a feeling that they're depersonalizing or that things around them aren't real. Some people experience a losing of control or a fear that they're going crazy, a fear of dying, a tingling sensation that can be localized to one part of the body, or a general overall tingling sensation. Some people experience chills, while some people may experience a heat flush. These are all reactions due to what the mind and the body are unconsciously doing while we're engaging in this fear response. Our perceptions of these experiences can greatly influence whether anxiety will exist in the future or if it stays, maintaining at the moment. Because fear is such a hardwired survival response to our perceptions, these responses will greatly influence our anxiety. These stress responses are meant to only last a few seconds to help us, avoid the dangerous situation or in some cases escape from it. Stress and anxiety set in when the response persists for longer than is expected. One disadvantage to our modern society is that we have all types of stressors continuing throughout our day without having any type of real physical or mental release. Unfortunately, anxiety disorders and chronic stress are some of the most prevalent disorders in our culture. The three most prevalent 12-month disorders found by a recent study were specific phobia, social phobia, and major depressive disorder. When you look at a 12-month disease classes, anxiety disorders represent 18% of the diseases in our culture. The most prevalent lifetime disorders are also anxiety disorders, representing up to 29%, with mood disorders falling at 21%. Anxiety disorders are the most common mental illness in the U.S., affecting roughly 40 million adults in the United States alone. The good thing about anxiety disorders is they are highly treatable, but unfortunately only about a third of those with an anxiety disorder will seek treatment. So let's talk about what's going on inside our mind and our body during this type of reaction, a fear response. When an individual senses a life-threatening event, such as hearing a stranger in their home, seeing a vicious animal, smelling smoke in a building, or any other type of threatening event, the mind and body engage the sympathetic nervous system. Now, this system is responsible for prepping our body and the mind into what is generally known as the fight or flight response. We engage in this system in order to get rid of the life-threatening agent or to remove ourselves from the situation. Such examples of this response will be that respiration and blood pressure go up to provide oxygen and blood to large muscle groups to prepare us to fight or flight. Our cognitions often restrict, and we go into a more habitual pattern of acting. That's why a lot of people will say, I wish I would have done that, when they look back on a situation. But at the time, they didn't have access to those higher level cognitions. Our brain is simply trying to be in a survival mode, and all these other thoughts just sort of get in the way. The body may make itself lighter to prepare to run faster. And unfortunately, that's when we see people who will eliminate their bowels, their bladder, their stomach. But This is all done in a method to make ourselves faster so that running away will be more effective. There are also chemical responses, such as the addition of adrenaline to the body, which is there to help increase strength or speed. Dr. Cannon was a psychologist who first was able to describe this response and identified some of the chemical changes which occur. Now, all of this response is healthy and natural, and it's designed to last for a few brief moments, just long enough for us to get out of danger. The problem occurs when we stay in this response too long and aren't able to calm down or physically release any of this energy that's been building up. Our mind can begin to trigger the stress response when there isn't a perceived life-threatening event because it worries about the effectiveness of how we will deal with future events. Again, we'll talk about that in a few slides. You'll see that some people will worry about having a panic attack or even have a fear of being afraid. Okay? Now, Dr. Cannon identified the fight or flight, but there is another response that we can engage in, and it's labeled freeze. Depending on the specific life-threatening situation, the person involved, and the availability of other factors in the environment, the mind-body response will go in one of three directions. Now, each of these has a benefit given a certain situation, but of course there's also detriments. Fighting allows us the potential to defeat the dangerous situation. Our body will force oxygen and blood to muscles, and our brain increases adrenaline to make us stronger. Fighting gives us a physical release through action. The release gives immediate feedback to the brain, letting it know when to engage the parasympathetic nervous system, which is responsible generally for calming us down and undoing everything that was done during the sympathetic nervous system. While most people may avoid physical confrontation, the benefits of going to a gym or playing in a sport, they're also effective methods for relieving this physical attention and allows the brain to calm down. Flight is when an individual runs away from a situation. This is most effective when the dangerous situation is too large to confront or impossible to confront, or in those situations where fighting would be more dangerous. An example of this would be if you're walking on the sidewalk and some car jumps the sidewalk or is out of control in some method. Obviously, you don't want to fight the car. That doesn't work well for most people. So running away, jumping out of the way is more an effective option. Even the process of running away and escaping the situation provides the brain with the signal needed to calm down and let it know that danger is no longer present. While this is generally effective, some individuals have been known to run away from their problems, which can only delay the resolution. The third response is freeze, and it occurs when we do nothing in the face of danger. It involves a total immobilization of the body. Our ancestors may have engaged in this kind of freeze response to reduce movement in hopes that some large predator would just simply lose sight of us and move away. Freeze can be a negative response if danger is coming toward us, and many individuals may freeze when stress rises, which prevents any type of resolution or release. All of the reactions freeze can cause a great deal of harm because our perceptions of the event start to kick in, and that's what we'll talk about now. How we remember things from our past is greatly influenced by our perceptions of the events. This occurs with almost all memory and is really the reason why eyewitness testimony can be flawed. In the case of life-threatening events, how we view the success or failure of our actions will play heavily on how we handle future events. This evaluation of our techniques can be helpful and to develop more effective methods of dealing with danger, but it can also cripple us mentally and emotionally and make us doubt our abilities. Anxiety develops when we perceive ourselves as failing to succeed over danger. If a person doesn't feel like there's any method that they can engage in order to succeed, they may begin to worry and be nervous about an upcoming event. our mind can begin to play out potential future scenarios where we will not be successful. And this is often where anxiety begins to develop. Your feeling response will either trigger a relaxation response or a stress response. For example, if a burglar broke into your home and you were able to fight or scare them away, you may feel you succeeded in this event. Your thoughts and feelings that follow may be positive, and you will feel more confident in defeating this type of event in the future. This generally won't cause any type of anxiety or stress response because you have the confidence to know that you can overcome this in the future. Some people, however, may not have been able to scare off the burglar or through their own actions weren't responsible for them leaving. This perceived failure will trigger feelings of anxiety and worry that the event could occur again and that they may fail again. This is why many victims of burglary will engage in drastic actions such as to secure their safety with expensive alarm systems, purchase handguns, buy large dogs, all in an attempt to reduce their anxiety. Now, Dr. Bernie Siegel said it best, "Thoughts with emotion are chemical. Your feeling response will either trigger that stress response or a calming response." So you have your event, you think about it, and then the emotion occurs, and depending on how you view your success depends on whether or not anxiety develops. If a person views the event negatively, then our perceptions will turn negative for future events. People will worry and have anxiety about their success in the future. If our mind begins to have negative perceptions, these thoughts can ruminate into a negative spiral. We may start to worry about future events, question our ability to prevail in those situations, and feel generally powerless about our future. With these negative thoughts or emotions, which is where worry and anxiety come from. Now here's a list of some of the more common anxiety disorders. First off, I need to say that this lecture is not intended to diagnose anyone. Some of you may have an anxiety disorder. Some of you may know someone with an anxiety disorder. And hopefully some of you are out there that don't have any anxiety at all, which is a great thing. But here are some of the anxiety disorders. First off, we have panic disorder. Panic disorder is the fear of having a panic attack. Now, this may be in conjunction to having actual panic attacks, or it may just be the worry that such an event will occur and cause embarrassment to the individual in a social situation. Panic disorder is a perfect example of how fear can turn on itself and people will be afraid of having fear. This plays a role in addiction because people will anticipate situations that may or may not occur and already prime themselves for failure, which would be, in this case, a panic attack. Another anxiety disorder is obsessive-compulsive disorder. People with obsessive-compulsive disorder, also known as OCD, will have a need to engage in ritualistic behaviors or patterns or thought patterns that help them control their environment. The underlying fear and anxiety in this disorder is that if the person doesn't engage in this type of behavior, then something catastrophic will happen. These individuals always have a prevailing sense of fear because they don't have a view of success in anxiety-provoking situations. Now, post-traumatic stress disorder obviously is a trauma disorder, but it occurs from fear and anxiety and the mind's inability to process a traumatic event that has occurred. The mind may worry that such events will occur in the future. Now, trauma is stored in a different area of the brain than memories. So often these experiences may be unconscious for people. Some people may trigger a trauma response without knowing it. And you can imagine how fearful that may be, that a person will have to relive a trauma without having any kind of priming event that they are aware of. Social phobia and specific phobias are more common as far as anxiety disorders. Social phobia is the fear of being in public and being embarrassed in public, either by their own actions or through the conversation of others. These individuals have likely had an experience in the past, were not able to successfully overcome that, and now the mind has kicked in with negative perceptions that all social events will be negative. A specific phobia can develop when a person has really an irrational fear towards a specific object. Now, this may be an insect, a snake, a rat. It may also be towards situations such as closed-in spaces or heights, or it may involve some type of medical procedure, injections. What has occurred here is a person has likely experienced one of these events, and the mind did not handle the situation effectively. People then worry that they are not able to succeed when confronted with this event. Most people with specific phobias realize they have an irrational fear which only plays against them because they know it's irrational, yet they cannot keep their body from experiencing this stress body response. Now, general anxiety disorder is an overall daily feeling of anxiety. People may have had negative experiences in one area, but because the mind will ruminate and continue to talk negative, they will generalize one experience into several or into all experiences. These people experience a lot of discomfort throughout the day, both physical and mental. And these are the ones that are most likely to seek treatment. Each anxiety disorder has a different symptom, but all the symptoms cluster around excessive, irrational fear and dread. So, when a person experiences this mind-body fear response and it goes on longer than is intended, we can actually have a lot of physical symptoms come from this. As mentioned earlier, your respiration is going up, your blood pressure is going up, you have a tightening of your muscles. That is all a normal response. However, if allowed to persist, we can see some really severe health problems. So here's a list of chronic stress-related illnesses. Now, you can have mood disorders, you can have a bipolar disorder. Where these play an effect is that a person who experiences anxiety for too long will develop, in a sense, learned helplessness. There is nothing I can do to control my world, so depression may set in, and a bipolar disorder could follow with that. Oftentimes you will see anxiety and depression diagnosed in the same person. People may develop an eating disorder. This could be due to fear of how they may look in social arenas. It may also be an attempt to overeat to help gain control and provide comfort. Food is very comforting. It provides a lot of chemical responses in our brains that we enjoy. So some people will overeat to gain more of that comfort. Symptoms such as headache can occur, which occur from, again, the tense muscles, the high blood pressure. Due to various abdominal situations that can go on during the fear response, people may develop irritable bowel syndrome or other type of abdominal disorders. Sleep disorders may occur, preventing people going to sleep. People may have nightmares about anxiety, either that they have experienced or that they worry may occur in the future. Substance abuse, which of course is one of the main focus of this lecture, and we'll talk about, of course, later. Some people may have disorders as ADHD, body dysmorphic disorder, those are individual cases which could occur due to neurochemistry being altered and other types of factors that we can talk about later. Chronic pain and fibromyalgia are often seen in people with anxiety. They become hyper-aware of their environment. They stay tense. They have a lot of physical tension and body processes going on, which make them perceive pain more than a person who is not in that event. Now, I did talk about overeating. Diseases like diabetes may occur when a person is seeking out those specific comfort foods that could be high in sugar or other bad things for us. With a heart that is pumping more because of the fear response, people may develop heart disease. Obesity may also occur because of the overeating. So, when we look at the different factors, obviously there's the debate that has gone on forever and will go on forever of nature and nurture. Anxiety disorders develop from a complex set of risk factors, including genetics. It can also include brain chemistry, personality, and then, of course, those life events that we've been talking about. Nearly 1/2 of those diagnosed with depression are also diagnosed with an anxiety disorder. Generalized anxiety disorder affects about 6 to 7 million adults, which represents roughly 3% of the population of the U.S. Now, studies have shown that women are twice as likely to be affected as men. The reason for that is not necessarily clear. Our children aren't even safe anymore from anxiety disorders because 1 in 8 children are likely to be diagnosed with an anxiety disorder. Research shows that even untreated children with anxiety disorders are at a higher risk to perform poorly in school. They may miss out on important social experiences and milestones and engage in substance abuse at an early age. The graph that I have up here shows that while we do have our DNA, our genetics, and our life events, which could affect how our bodies perceive stress, anxiety, and fear, there are other cultural things that may occur. Depression, we've already talked about. Some cultures, some areas of the United States are more prone to anxiety. Being raised in an environment where caregivers and other people that we are surrounded with who demonstrate anxiety, who are fearful and have maybe irrational fears, there have been several studies to show that children will pick up on that anxiety and take that into themselves. Being a victim of trauma obviously increases the likelihood of an anxiety disorder. But one area that people often neglect is nutrition. What we eat, how much we eat of it, when we eat, and even the amount of liquids that we consume can often prime our bodies for stress or anxiety. Being undernourished, malnourished, or even dehydrated will often cause the body to be in a stress response because it is being threatened, because it is not receiving the nutrients that it wants. So then when it experiences any outside event, being already primed for stress, obviously the stress reaction will be more severe. Other factors that can affect anxiety are our emotions, how we look at ourselves, any type of resentment that we may have towards others, any type of guilt that we may feel plays in on that negative perception of our success, of future stressful events. Some people have control issues where they want to be in control of everything. Obviously, this is an irrational belief because we cannot control everything. This sets the person up for failure because as they realize they lack control, the anxiety is there and will increase. Some people are perfectionistic and, of course, are faced on a regular basis that they are not perfect. People cannot handle that cognitive dissonance, so they will often have a fear response. Catastrophic thinking, procrastination, these are all other types of emotions and thoughts that go with the emotions that can help prime a person for anxiety. Now, let's talk about the type of medications used to treat anxiety, because this is what most individuals will become addicted to. Medication can be very effective in temporarily reducing the negative symptoms of anxiety because of how quickly it can provide relief. Because of how quickly it provides relief, medication is often the first treatment option individuals try. Now, a responsible psychiatrist will prescribe an anti-anxiety medication along with therapy. The problem that we're having with most of our culture is that people are bypassing the psychiatrist and going to see their primary care physician, who will prescribe the medication but may not necessarily have an emphasis on treatment, therapy treatment. Individuals will rely heavily on their medicine and not develop any other type of coping strategies that could be obtained through therapy. Because of the positive experience that many people experience from taking their medications, they have no need to develop any of the other strategies. Why deep breathe and meditate when you can just take a pill and in 30 minutes feel better? Not only does this prevent, the non-medical longer-lasting techniques from being developed, many of the anti-anxiety medications are habit-forming in nature. As with most types of prescription medications to treat anxiety will have a wide variety of negative side effects. People can experience anything from drowsiness, weight gain, aggression, and suicide risk. So here I have 3 types of medications used to treat anxiety. Right now, the most popular types of medications for anxiety are benzodiazepines, or benzos. Generally, if someone's calling it a benzo, they are probably misusing their medication. Now, these types of medications act very quickly. They slow down the central nervous system, and they present the person with a very pleasant, calming effect. These are some of the most addictive of the medications. An example would be Xanax. Xanax is highly habit-forming because of the experience that the person has and how quickly it alleviates the symptoms. Now, antidepressants can also be used, medications such as Paxil and SSRI. They generally take several weeks, though, to take effect, and with them comes some negative side effects such as weight gain, aggression, and suicide risk. Beta blockers are effective at reducing the physical symptoms that we have during these stress and fear responses, but they don't address any of the mental symptoms that a person may have. So, how does a person become addicted? Some individuals may increase prescribed dosage of their for preventative measures. Because of the quick effectiveness of benzodiazepines, individuals rely on their medications to eliminate any anxiety. Some individuals may start increasing their recommended doses as, like I said, preventative measures. This would be, I know I have a big meeting today, so I will take an extra Xanax to keep myself calm in order to experience any anxiety. The nature of these medications are so pleasing that even minor anxiety will start to become overblown in the person's mind. Instead of taking them during a true anxiety-provoking event, a person may just not want to experience anxiety. And this begins the start of addiction. Each individual who takes their prescribed amount can become physically dependent within a matter of weeks. Experiences of anxiety may be increased as more severe. This person may overblow the situation because of that physical need for the medicine. and then a dangerous cycle develops. Oftentimes, the cycle develops when the person immediately relies on medication to address their symptoms without using any other non-medical method. This over-reliance on the medication is satisfying to both the mind and the body because it provides immediate relief without very little action. As the medication wears off, however, the symptoms of anxiety return, thus leading to more medication use. Now, medication tolerance will occur. As a person will begin to tolerate their medicine, the cycle will progress quicker and quicker. On the slide that I have here, if you'll notice the relief of symptoms, everything is equal, all 1/3 on the cycle. But as a person begins to tolerate, the relief of symptoms will shrink. This is a negative experience when they start to have symptoms of anxiety again. To help address the reduction of relief of symptoms, the person will more likely use their medication quicker to avoid feeling any type of anxiety. So, which came first, the chicken or the egg? In this case, which came first, anxiety or addiction? The dilemma we face in chemical dependency is trying to determine this. Many disorders can be temporarily symptomatic due to chemical dependency and or abuse. In these instances, many times the symptoms of the disorder will subside over a period of time, usually 6 months to a year on average. If the disorder came first and was a motivating factor to use chemicals, whether they're prescription medication or illegal substances, then likely the symptoms won't dissipate after the chemical use is discontinued. Often what you'll find is a person diagnosed with anxiety will self-medicate using alcohol, marijuana, or any other type of illegal drug in order to calm their body down, in order to give them some control. However, when that wears off, the anxiety is still there. In situations where addiction comes first, a person has found themselves dependent on an illegal substance, they will often experience anxiety as they try to withdraw from any substance. People may notice that when they're sober, the world is too real, so they will re-engage in their addiction, and the anxiety will be a triggering event for the actual substance use. Signs of medication dependence can depend on the person, but here is a list. Daily use of the medication for several months. Benzodiazepines are tolerated very quickly and can become habit-forming within a few weeks. A person who is on Xanax for several months can often be dependent on the medication, both physically and mentally. Any type of tolerance is an indication of a dependence. Use of any other type of drug or alcohol in conjunction with the prescribed medication. This is when people will use Xanax and chase it with vodka because it will add to the calming effect. Anytime there's an increased dosage during potential stressful events, and of course when any illness occurs when the person attempts to stop the medication. So, what actually works? These medicines are very effective in reducing that, but you want to help people develop new techniques in order to not rely on their medications anymore. So the therapies that work, the 5 basic therapies are relaxation response, mindfulness, guided imagery, hypnosis, and cognitive behavioral therapy. Now we'll talk about each of these now. First off, relaxation response. Dr. Benson said that the relaxation response is a physical state of deep rest that changes the physical and emotional responses to stress, and of course is the opposite of fight or flight. Through relaxation response, an individual is engaging their parasympathetic nervous system at will. Now, a lot of techniques are used for relaxation, but progressive muscle relaxation is one of the more effective. when a person will specifically target one muscle group and will deliberately tense it for a prolonged period of time, followed by a slow relaxation, and helping the person understand what a relaxed muscle feels to a stressed muscle. The goal of this treatment is to help the person self-soothe and help them trigger a relaxation response whenever they feel any type of stressful event. Mindfulness is the second technique. It can be traced back to Hindu scripture and was inherited from Buddhist tradition. Mindfulness is paying attention to the immediate present, not worrying about the past and not worrying about the future. This is extremely helpful with individuals with generalized anxiety disorder, social phobia, or even specific phobias, as they tend to worry about their success in future events. Mindfulness involves an overall body scanning as well as a sensory scanning without allowing any type of cognition to form. One of the hardest things for people as they start mindfulness is to shut off their internal dialogue. But shutting off that internal dialogue and letting the person be in the moment increases their ability to relax. It gives them better focus, greater energy. It'll even improve their self-esteem because they start to have control over their body. They can shut out the negative thoughts, they can shut out the worries, and it teaches them that skill. And it also helps them effectively deal with stressful events because they don't have an immediate reaction anymore. They can process the event more slowly and with more success. The third technique is guided imagery. Now, guided imagery is basically allowing the mind to progress through a certain scenario, and since we have control over our imaginations in almost all situations, allowing for success to be played out in the mind. Another way to do guided imagery is to help the person daydream, to get out of a stressful event. This is especially useful in individuals who may freeze. It allows them to escape but still be in the moment. Generally, when you do guided imagery, you want to have a complex narrative with a lot of details to provide the person. You want to guide them specifically on a track that allows them to have healing, to have success, and allows them to overcome any anxiety events. One of the benefits of guided imagery is that it increases their skill efficiency, and there's actually been studies shown that they can heal both physically and psychologically through effective guided imagery. Hypnosis. Now, hypnosis is not what most people think it is. Hypnosis can be used to help you gain control over undesirable behaviors, or even help you cope with anxiety and pain. It's important to know that although you're more open to suggestion during hypnosis, you don't lose control over your behavior. And I think that's where most people have a fear of hypnosis, because they see the people that can cluck like a chicken or anything like that, and that's not what hypnosis is about. It is a trance-like state in which you have heightened focus and concentration. Hypnosis is usually done with the help of a therapist, obviously certified in hypnosis, using verbal repetition and mental images. And they basically induce a process of deep relaxation and allows for suggestibility to the mind to increase control over anxiety, to visualize more successful strategies. There may be some work on pain control, which of course, individuals with chronic pain, that will help lower their anxiety and fear. And of course, hypnosis can also be used to increase the ability to control undesirable behaviors. Now, some people do use this for smoking cessation, but as it applies to anxiety, you would want a person to be able to have control over any type of embarrassing behavior that they perceive they could engage in out in a social situation. You may also use it for panic attacks in some cases to help reduce or even eliminate future events. Okay, and then the final treatment that is effective is good old cognitive behavioral therapy, CBT. In CBT, the individual is encouraged to challenge any type of irrational belief. Part of this process involves viewing negative beliefs as ideas rather than facts, and to test out such beliefs by running an experiment in their mind or acting out an experiment within the therapeutic setting. People who are participating in CBT are encouraged to monitor and write down their thoughts as they go through their day. Some people are prescribed an anxiety journal or a feelings journal. This is effective because it will help the person know when they are having irrational beliefs. Then you teach them skills to control their behavior and their thought process so that they can overcome these events. It allows the patient and the therapist to search for patterns in the thinking as well that can cause them to have negative thoughts, which lead to negative feelings, of course. It's a form of treatment that is very text-based, and that may be why it's not always effective for other individuals, but it definitely challenges their irrational beliefs. It helps them monitor those automatic negative responses and allows them to develop more effective behavioral patterns for future events. The goal is not to focus on one type of treatment. Anxiety, fear, and stress can come at us in all different types of directions. So really the goal is integrated treatment using all 5 of these methods, and of course in some cases using medication responsibly for the more severe events. A good therapist will combine both CBT, relaxation, mindfulness, and even hypnosis if available in order to provide the person with a full complement of coping skills in order to prevent the anxiety from occurring. If we can stop the anxiety, we can stop the addiction. I'd like to wrap up just by showing something that we like to incorporate AA 12 steps as it applies to anxiety relief. Step 1 would be admitting defeat. Step 2 is seeing hope for the future. 3 is, of course, asking for help, not just from the therapist, but from other supportive people in their lives. Getting honest about their abilities, about their irrational fears, and other type of situations that can cause stress. Tell on yourself if you need to. Let it go when you need to. Remember to always ask for help. Work on amending any type of situations. Work the plan of amends. Tell on yourself every day. It basically means being honest. Pray for relief, especially if the person is spiritual. And then help someone else tell on themselves. That last step is always very confidence building. It increases self-esteem, and that is how we help people with anxiety and addiction. Okay.
Thank you again,
everyone.
Go ahead, Christopher. Sorry.
I was just saying thank you. Thank you for everyone and allowing this opportunity to share this information.
Christopher, you did a very informative presentation, and I just wanted to thank you. My apologies for getting in too quickly. Before we get to our Q&A, I do want to hand things over to Melanie Melcher from Foundations Recovery Network for a quick word from our sponsor. Melanie, the audience is yours.
Thank you, Charlene. Here at Foundations Recovery Network, our grassroots movement called Heroes in Recovery has a simple mission: to eliminate the social stigma that keeps addicted individuals from seeking help, to share stories of recovery for the purpose of encouragement and inspiration, and to create an engaged, sober community that empowers people to get involved, give back, and live healthy, active lives. Join us in this mission at our 6K race series at these locations across the country. As a thank you for your attendance today, please enjoy the discount code Webinar 2014 to register for any future 6K event. Back to you, Charlene.
Thank you, Melanie. And we have had a number of questions from the audience that have come in, and we want to remind you in the audience to use the Q&A widget below the slides on your screen to submit a question at any time. One question that was kind of repeated, and this, Christopher, is can you possibly give some clarification on the role between anxiety and bipolar? And one person wonders if diagnosed bipolars might be avoided if anxiety could be addressed at an earlier stage.
Okay, that's a great question. Oftentimes I've found that people will be diagnosed bipolar because the individual who has seen them and diagnosed them with this condition saw them during what they would think would be a manic phase, and they're going with the patient's response that they've had depression in the past. A manic phase may be a person's anxiety, uncontrolled. People experience depression along with anxiety, and I've seen a lot of people will misdiagnose bipolar simply because they see anxiety and depression, and they mistake anxiety for mania. So that's why I think if good screeners for anxiety could occur early on and help people rule out the manic or hypomanic episodes as more as a panic attack, a fearful response, even people engaging in hyperactivity as a coping mechanism to avoid facing a stressor or a fear event. But yeah, I think more needs to be done to screen anxiety to help rule out some of these bipolars.
Thank you. We have another question that I found very interesting, which you touched on, and that was regarding on your slide on the brain, the role of the brain. And someone wants to know, which I think is a good question, does the maturation of the brain, what does this have to do with anxiety development in young adults and those with addiction and mental health disorders?
Unfortunately, when anxiety and unsuccessful fear occurs, the older a person gets, the more they may ruminate on a perceived failure or a worry that this event could occur again. I think that's why 5-year-olds have no fear. It seems they're brave because they don't know failure, or they don't know the full range of danger that's out there as well. As we get older, there are more stressors that occur, there are more worries that occur, and people do think more about their perceived failures than their perceived successes. Now, how addiction can form is that introducing any type of substance or any type of activity even that can help reduce this thought rumination or even this negative experience of anxiety is going to be very pleasurable. You're actually introducing an outside agent that takes over what the brain and the mind should be doing. So oftentimes that is why addiction and anxiety go together, because people are actively using to avoid experiencing any of these negative symptoms. And as we get older, that just becomes more habit forming. So maturation is definitely linked to the anxiety addiction process.
And how, when the person walks through the door, how do you distinguish between whether the person has an anxiety disorder or an addiction, particularly, of course, if you know they've been using?
It is difficult as they walk in the door. I think that is probably where some misdiagnoses occur, when the person feels the need to label an individual right at screening. Now, of course, thanks to insurance and other agencies that require this, we have to diagnose. I always ask people, when do they remember the addiction occurring? They may have had substance use or some of the other activities in the past, but when did they see it getting out of control in their mind, which would be the addiction process? And then we talk about what is anxiety for them. Most people relate anxiety just to stress, but there's, as we talk today, there's a lot of other ways this can occur. And then you ask the person, why were they continue to engage in this addictive behavior? And some people will say, well, I really didn't like thinking this way, or I didn't want to worry about work, or I didn't want to go home and do this, and so this was a diversion from the anxiety event. Of course, that would suggest the person had anxiety first and was using. Also, you want to look at, what was going on in their life when things really started to get out of control. Would they just, if it was an illegal substance, were they staying intoxicated throughout the day, every day, and experiencing anxiety only when they couldn't obtain the substance? That would be more of an addiction process with anxiety coming out because the brain has not had to worry about any type of unpleasantness because of the substance abuse. So it's really just a detailed conversation and helping the person. It's almost like doing CBT at screener, which is a little weird. You help the person trace back which started first. Was it an anxiety that they chose to ignore through substance use, or did they just begin an addictive process and felt anxiety whenever they were, tried to be sober?
Thank you, Christopher. We have time for one more question, and there have been a couple of questions regarding nutrition and what you talked about, and they've asked if you could repeat what you said about nutrition and malnourished people and the result that is in anxiety.
Okay. I could probably do another hour-long webinar about nutrition and anxiety, but I'll try to condense it. Our bodies want to run efficiently, and they need certain amounts of nutrients to function. And oftentimes, due to our society, our work schedules, our just time limitations, people don't always eat as healthy as possible. Sometimes we will eat a meal that we think should be satisfying that has no nutritional value. People are more likely to snack on potato chips or cookies than an apple or a banana just due to the convenience. Well, while this provides a feeling of fullness in the stomach, it provides no nutrients. The body has to run. It's a machine. So it needs certain vitamins and minerals and all kinds of different things. When we don't provide it with that, the machine doesn't run as effectively. When the machine's not running effectively, it's going to be prone to injuries. It's going to be prone to any type of disease. And it puts the whole body in a state of alertness. It's easy to see the car coming toward you and know that that's a life-threatening event. But our body doesn't really communicate when it's not getting the right nutrients. But still, it is being threatened. It is having to make allowances and having to operate less efficiently than it should. That creates stress. We don't even realize we're carrying that stress. And that will when we do actually experience what we know as stress, we're already primed up there. And the second thing, and I know we're running out of time here, hydration. Dehydration puts the body in a crisis situation, and oftentimes we don't recognize that we're dehydrated. So I would just encourage everyone to look, read up on, hydration, how much we're supposed to drink, and, the days that you drink enough water, you definitely feel it when compared to the days you don't drink enough water. And, that just sort of primes the body to run efficiently and prepare itself and work the way it's supposed to.
Thank you very much, Christopher, for condensing another topic, as you say, for a webinar. Unfortunately, that's all the time we have for questions today. We do have some final instructions regarding CE credit. CE Learning Systems has approved today's program for 1 continuing education credit. To receive your certificate of completion, you must click the green CE certificate widget, complete the evaluation form, and click Submit. For those watching in a group, as a reminder, please download the group submission guide and program evaluation located in the resources area and follow the instructions. Please note that CE credit is not available for the archived webinar and only for today's live event. If you have any questions, please click the purple Contact Webinar Help Desk widget at the bottom of your screen. Once again, I'd like to thank Christopher Hastings for an excellent presentation. I also would like to thank Millennium Laboratories for making today's Foundations Recovery Network program possible. Finally, thank you to those of you in our audience for participating today. We hope you'll join us in the future for another Addiction Professional webinar. This concludes today's presentation.